All right, so welcome again to the medical student series. Um, this is where we help you to pass your exams. Now, I'm going to be teaching you a trick today, so make sure you focus and watch till the end. How many of you have been scared because of examination stations during OSCEs? So, stations where you would need to examine patients. There are many ways. There are many ways we structure these exams now. We either put them as part of the OSCE or we put them as an examination station, maybe during a long case or a short case examination. But the key thing is you are required to examine a patient and your examiner is watching you. So students are usually very afraid when it comes to this kind of exam. I want to tell you, it's very, very simple. Very simple. Of course, the adrenaline is always going to be there, but there are simple techniques. I want to teach you a simple technique. It's called the imagination technique. The imagination technique. It means that you must be able to go through the motions of your examination in your head even before carrying out the exam. Let's say, for example, you would need to examine the abdomen. It means that you would have read about abdominal examination and then you practice with your friends to do abdominal examinations. But I can assure you, even when you practice with your friends, you get to the exam hall, the tension will make it such that you will forget everything you've practiced. This is where the imagination technique comes into play. Now you will sit down after doing the examination. You will be in your hostel, sit down and go through the motions in your head. Go through the motion of you walking into the exam hall, you greeting the examiner, greeting the patient, inspection, palpation, percussion, and auscultation. And imagine yourself being very happy with yourself because you've done a very beautiful exam and you're saying, "Thank you very much, sir," and "Thank you, patient," and taking your leave. Do that imaginative thinking from beginning to the end and time yourself. So typically, you would have found out maybe from your seniors or even your own set about how many minutes are required for you to examine the patient in an OSCE station. Usually it's an average of 4 minutes. The maximum is 5 minutes. Sometimes it might be less if we don't want you to demonstrate too many things. So you will set your stop clock and go through those motions in your head, just in your head. Do that consistently, maybe for 2 or 3 days. Just 5 minutes or 10 minutes. Let's imagine that you do it now. You check the clock and you do it twice. That's just about 10 minutes. And do it like that for 2 or 3 days. I can assure you, you will ace that examination station. The importance of you examining with your friends is so that you can show the examiner. That's to help performance. All right, so your friends will tell you when you bend down, I say, "No, you did not bend down properly," or when you did like this, it didn't look real. When you are palpating, you should have used this. No, that's the importance of you going through those exams with your friends. But in terms of remembering the examination and going through those steps, you need to have the power of imagination. The power of imagination is so strong that even if you've never done it before, because you've imagined yourself doing it many times, when the time comes, you will be able to do it. So, the key point today is the power of imagination. It will help you in acing your examination stations in any of the exams. Right? So if you have any questions, drop them in the comments. I'm going to be talking about some other areas of your examination subsequently. Cheers.